Could you please address the issue of A, blood type, and COVID?
Yeah, I just was reading about this. Elizabeth and I discussed this morning whether this was worth bringing up today, but since the question was asked, there has been a study that was just published, I believe yesterday, stating that patients with certain genetic makeup have a higher risk of developing more severe forms of COVID and specific.
Okay, we can't hear you, unfortunately. So I don't know, while we're waiting for Dr. Kogan, I saw that one of the questions that was talking about, asking about considerations about families and social distancing. There's an article in the New York Times of how to hug in the age of social distancing that a friend sent me, and I'm going to post it in the chat. It was maybe the most encouraging thing I had seen all week personally. Let me see if I can find that. Like how do you handle a pandemic hug? All right. Yes, unfortunately, I think Dr. Kogan logged out and is probably restarting his computer. So while we're waiting, I know there was also, I had seen something on Twitter, and I can find that was from a nurse talking about the best way to protest, which is another question in our chat. Dr. Kogan just came back, I think. I hope.
Try to get through on my cell phone, so
okay,
I'm gonna
yes.
run video here.
All right.
And then I'm also gonna try to join on the computer again. So I don't know what's going on, but my computer is freezing.
Okay.
It keeps crashing. This is brand new computer.
I'm so glad you're back. So we had a question, what are the must-have questions or considerations families must ask or make when making decisions about easing up on social distancing? Grandparents with grown children and grandchildren in particular.
There is no easing on social distancing, absolutely, and I don't anticipate any easing anytime soon. I'm assuming I would put 6 months mark for now. We do know the virus is still here. We know that it's increasing in prevalence and it's been spiking in multiple states. We don't know whether our location, there's going to be anything different in that domain, but we should anticipate that the actual standard social distancing precautions must stay where they've been before. And I would not say that anything is changing there. So if you're using the mask, the only difference now with the masks, I think it's probably quite safe to assume that the surgical masks are adequate for almost everybody, unless somehow your loved one that you exposed to has a current disease. But in that case, it's best that person is isolated anyway and you have no contact with him or her. I can't hear anything.
So given that there are people who will be in crowds right now due to protesting, can you talk about kind of what is the best risk mitigation? What would you say is the best protective action one could take? Now you're muted. I'm unmuting you. You're muted, Dr. Kogan. Okay.
All right. I was
Yep.
just getting echo because I was on the phone. So let's see
Okay.
if that's going to work. Can you repeat the question? I'm sorry about all this trouble.
Sure. So the question is, given that a lot of people are going to be they are going to be in crowds, what are some of the best protective action or risk mitigation strategies?
I think the masks are most important. So wear a surgical mask if you're unable, especially if you're unable to maintain 6 feet. And actually, regardless of that, if you go to any crowd or any activity in public, I think the mask is absolutely the must. And also frequent hand hygiene, regardless whether you like wearing the gloves or not. We actually did discuss gloves that it's probably not ideal to wear them unless there's very specific situations, such as, again, acute exposure to somebody with known infection. Otherwise, I would just use a frequent hand washing or use the gloves that are thin cotton gloves that you can frequently exchange. But mask is the must. And if you can't avoid the crowds, I would still do that.
Okay. Thank you. I also personally had heard, carry hand sanitizer and, don't share your water bottle.
Yeah,
And
absolutely.
then since unfortunately you had dropped off, can you repeat what you had talked about regarding blood type, please?
Yeah, so what we know with the blood type, there's a study that was just published yesterday that claims that patients with group A blood type have chances of developing more severe form of COVID. We don't fully understand why that is. The same research group has specifically looked at a number of other genetic predisposing factors. I'm guessing we're going to know more soon. I also don't think that somehow necessarily in the immediate future affects what we should be doing about it, because it's not really clear whether it's an isolated marker being a group blood type A, or if it's in conjunction with something else. And it's also not clear, clinically speaking, how it should be addressed any differently. I think we should.
Yes. Is there something that you wanted to specifically address?
So Elizabeth, maybe what we should do is just go forward with the
Okay.
mindfulness part, and I will try to figure out what's going on with my computer.
Okay. Sounds like a plan. So we were just talking about protests and, um, this past week has been really difficult. I'm a white person and I'm, in DC and feeling, the difficulty of violence. Um, and what I wanted to say is that, in addition to all of the COVID craziness and uncertainty, there is also the collective grief that we are all navigating. Came the murder of George Floyd, a Black man, under the knee of a white police officer while 3 police and all of us watched. And we also all know of so many other Black men, women, and children who are subject to the violence at the hands of law enforcement, the people we expect us to protect and serve. And, we all experience that differently too. Um, and then we saw cities around the nation erupting in protesting and violence and inciting these cycles once more. It is wonderfully encouraging to see that people are still gathering in solidarity. However, George Floyd could not breathe. And I know this week, this moment, I have found it difficult to find my own breath. That piece. So today we'll start with a meditation. We'll just start from some deep breathing. And I borrowed these 9 breaths from Luann Jacobs, an incredible mind-body practitioner and Reiki master, and who'll be also joining. So I've taken select out of a larger piece that she did. And then we're going to do actually a writing exercise So that was inspired by Audre Lorde's quote of caring for myself is not self-indulgence, it is self-preservation, and that is an act of political warfare. So to be effective and support our communities and our family, we have to take care of ourselves. You know, it can say like, maybe feel silly, like, should I be out and supporting, or should I take some time to meditate? You know, it feels it's not self-indulgent. It is important, and it's important for us to be centered in order for our own preservation, and as I said, for the communities, the ones we love. On that note, I ask everyone to make yourselves comfortable. Take a deep breath. Kind of adjust in your seat. Perhaps put your hands on your lap or next to you, whatever feels best. In through your nose, out through your mouth. Perhaps you put one hand on your chest and one on your belly, and you can feel that natural undulation of the breath in through the nose and out through the mouth. Nine breaths to guide us. Let us breathe through the world with gratefulness, because it's kindness and compassion that can heal us. Let us breathe for the world with hope, for it gives us access to joy. Let us breathe for the world with love, for it is love that endures. Let us breathe for the world as one, connected in rhythm, in synchronicity. For the ones who are tired, we bring strength to support you. For the ones who struggle to breathe, we breathe ease and peace for you. For the ones who grieve, we breathe with your loss. For the ones who are lost, we breathe and hold you close. We stand by you. And now together, let us breathe once more for each other. When you're ready, allow your breath come to its natural pace. And when you're ready, you can think of somewhere that brings you joy, and open your eyes. So I'm going to take this moment to share my screen. We're going to do a writing exercise. that I saw on the Audre Lorde Project website. There we go. Okay. So everyone can see this wellness planning document. You can give me a thumbs up if you can see it. The thumbs up. Okay. So with your pen and paper, we'll take the next 5 to 7 minutes or so. So right now we're in now, of course, we're in crisis many different ways, feeling pain as communities, feeling grief as communities, but also trying to live our lives. So in this moment, what are the needs that you can anticipate during this event, however you would define now to be, and think about where they fall. And so this, this chart, we have the needs, the body, mind, heart, and community. And you don't have to use this chart. This is just a suggestion, but just to kind of get your mind going on what are the things that you need to feel centered, to feel supported. Now, this is, kind of when we write, that's a type of mindfulness, right? Or mindfulness can take many different forms. So this would be expressive. And then similarly, think about who or what things in your life can help support those needs. So just take the next 5-7 minutes and to do this exercise. And afterwards, we will actually go into small rooms for sharing. There's no, but anyway, so I wish I had like hold music or something, but I could, take this moment to give some thought. What are the needs that I have in my heart, body, mind, community, and who or what structures in my life can help support those needs?
Janet, I think now we can all go into the breakout rooms. So you may want to resend it to everyone.
The rooms are now open.
You can certainly think about spirituality in one's life, how your body is physically feeling. All experienced a big change.
Elizabeth?
Yes.
Yeah, I was in a room. I was kicked out twice. There was nobody else there, so it's okay.
Oh,
I'm
okay. Well,
just
could
trying
you
to
share,
get.
would you like to share with the group that's here, kind of anything that has come up
Sure.
for you? Just any, yeah.
I mean, I'm in the process of creating art about this topic, so
Wow.
so you know, and here's one on the healing emotions. So,
Oh my goodness.
including what happened, didn't want to happen, all that stuff. But anyway, so
Right.
I like that community is added. But
Mhm.
anyhow,
Mhm.
I've been teaching work. I've been doing online, so I know how tough Zoom is. I'm doing workshops
Mhm.
for resilience using looking at hope besides the great wave. So
Sure.
anyway, but it's very much on my mind.
Okay.
Thank you.
Yeah, absolutely. Does anyone else want to share any of the any things that came up for them in their wellness planning or thinking about how to feel best supported? Kathy, what about you? Here, I unmuted. I am unmute. I can't unmute you. You have to unmute yourself. There you are. You're unmuted. You're unmuted now.
Yeah, I'm unmuted. All right, so it seems like this is kind of working.
Yeah.
What do
All
we?
right, Luann, did anything come up for you in this exercise?
I went to the chat room, I think, too early, so I missed some of the instructions, but I can follow the diagram that you put on the screen. And so I
Yep.
made a quick analysis. And I think that the thing I'm missing most is community because of the COVID and quarantine. I think I've got, I've got everything else working. And the community is really helped by being able to be in groups like this,
Yes.
Mara's meditation group, and I'm a volunteer at the hospital, and all volunteers have been stopped. So yesterday or 2 days ago, the people that I was working with there, we met at the beach and kept distance, but we were able to commune with each other. So I think the more we can in community support to support us during the time of being isolated in ways that are healthy for us is really, really helpful, really helpful. And then I belong to the dance group, and our dance group has been meeting virtually every 3 mornings a week. And then we got to meet this week because our community has moved on to phase 2 in an outdoor park, and we're able to dance together. And that was, it just made all of us so happy to be able to do that movement together.
All right, thank you so much. Kathy, what about you? You're unmuted now. What came up for you in your chart?
Well, the first one talking about heart. And clearly, I'm apart from my family and most of my children. So that I'm really very lonely, missing my children, and very sad about that also. And certainly when Misha was talking about 6 more months, which I knew, I really knew, but then to hear it from a professional was not easy to.
Sure. Did you come up with any ideas of structures to support those needs?
Well, I do think, as we heard from, I think it was Luann, about how community is important. And since I'm not in my usual community, I was having a difficult time thinking that, I do not have any large volunteer social groups here. So I don't know how I can forward with that. The other, of course, is mind. I contacted my friends more via phone or FaceTime. I think that might be a good idea to do, and especially do that with my children.
Okay. Next couple of minutes, anyone else want to share kind of something that, if it, not even necessarily on your chart, but something that came up for you in the process of writing or thinking about it that you may not have thought of before, or what's coming up for you? Ellen, you see you raising your hand. Unmute yourself, please.
I think this is a really helpful diagram for me. And I think I'll be using a lot to just when the grief starts to overwhelm me, to look and see that I'm trying to take care of these and identifying where it is. I think that the present conditions in the country are just oppressive to me personally, and I'm working with my church on some things with that, and I have helps and support in each of these areas. But this whole diagram is really, really helpful for me. So I want to thank you for that.
Great. Sure, you're welcome. Grace, would you like to, should I see you've raised your hand, which is awesome. I've never actually gotten to see how that feature works. Would you like to share with us what came up for you? I don't know if I can hear you.
How many people are in
I
this?
just lost power. That's why it's dark.
Oh, okay.
Yeah.
How many people are in the breakout group?
Yes.
Yeah.
So for body,
Yeah,
I've
Janet, if you can
been
end the
really
breakout.
disconnected recently, but so I really have to practice that. Can you hear me?
We can.
Yes.
Hello?
Yes.
Yeah, can't see much.
That's okay.
Can you hear me?
We can.
Elizabeth, did you want me to remove the breakout room?
Yes. If you could remove the breakout rooms, that would be great.
Hello?
Thank you. Okay.
I didn't realize you could share.
Hello?
I thought.
Yeah. So anyway, so we were kind of discussing, thank you everyone for bearing with us as we navigate Zoom. So some people, we were just taking this opportunity in the last couple of minutes here, if there are things that came up for people that were interesting or unexpected, or what the process of writing was like. If anyone wants to just chime in and say something that came up on their wellness planning, that would be great. Mary? Yep.
Yeah, I'll just say, I mean, one of the things came up for me of like, I've been really wanting to have more of a sense of community, like connecting more with people, sort of like-minded things. And that's been a challenge. I have like people here and there, and then some of my coworkers, yes, but I'm just feeling more of a sense of community, that a need for, connecting more at the community level. And that's been a challenge to kind of find all that.
Hello?
Yeah. Hello. All right. Well, definitely hearing a lot about community. I encourage people to go back and identify the support, use this as a kind of this is going to be a working chart, but kind of it's really helpful to go along with these mindfulness exercises, because then we can kind of channel it. And something that with any mindfulness practice, not everything is going to resonate for everyone. There's some people who are just like, meditation just does not do it for me. And that's fine. And part of this practice and part of what we're trying to provide in these weeks is the opportunity to build your toolbox and to find the things that help you center and help you challenge. So thank you for joining me in this being active exercise. I know something I'm finding very difficult during this time in the Black Lives Matter movement is figuring out how I can be best supportive and like take action. And I find even looking inside and doing this type of work is one way to move forward and take action even better in my own community. So thank you for joining me in this atypical exercise for this group. I'm going to hand it back to Dr. Kogan, hopefully with fewer technical issues, and can share and continue answering some of our questions this week.
Yeah, so I'm just sorry again that we had this difficulty, but I just put in the CDC report on disproportional effect of minority population by COVID. You know, and I'm also was going to talk a little bit about a really good mental health article that I found that describes the different stages, how we all have this honeymoon period and then it ends, and then there's this reconstruction period that we're entering, although frankly in the last couple of days I have not felt that we're entering any reconstruction. In fact, I've been feeling more and more lost in some ways, but nonetheless I'm putting that in for everybody to take a look. There's also apparently a capacity to save the chat, which I didn't know, so we'll do that, and we'll make sure that that goes on the recording. But I guess the rest of the time, I think we should take for questions and answers, since I know there's been a lot of questions. Elizabeth, since I had to restart the Zoom, I don't have the chat after 2 o'clock and 14 minutes. So if there are any questions that were before that, I can't see them. They're not on my screen. The N95, Suzanne, I don't think you have to use a N95 mask when you go to the hairdresser. I think the surgical mask should be more than sufficient. The N95 masks are critical when you're very close with someone who's actively sick. If you're exposed to someone who is either just getting the illness or they're still asymptomatic, it's quite unlikely that N95 is critical, because the surgical mask should be more than sufficient in that scenario. Okay, and then let's see what next. Private chats are not saved. The only thing that's saved are the group chat.
Okay, so all of these links, etc., will go out afterwards this afternoon.
Mm-hmm.
So just so you know, Dr. Gogan, do you want to go into the question, the kind of what you were talking about the difference in how minority communities are affected by COVID?
Yeah, so in that CDC article that I sent, and again, the link is there if you want to take a look at it. It basically looks like African American community, you know, has been hospitalized for COVID dramatically more compared to the total percent of communities. So it's 33% total number of hospitalized patients versus only 18 in the communities where the assessment was done. You know, that's just one example of this disproportionality, and also the number of deaths from the disease is much higher. You know, and that brings us to sort of the reasons why could this be, and you know, it's the living conditions that are different, and work circumstances are different, and you know, lack of healthy capacity to maintain healthy lifestyle and underlying health conditions that are more frequent. So all of those are, of course, the risk factors. You know, and to me, that all goes back and links into sort of what happened with you know, Floyd death and then the riots, and sort of like, it's basically, you think of it as a global scenario, a global situation, and I think part of why I'm struggling so much with this is simply that it almost appears that instead of this disease potentially being this powerful unified force that could help us to come closer together, instead it almost feels like it's actually segregating and breaking us apart even more. And I think that's, you know, hopefully it will change, and hopefully this kind of a crisis right now highlights the need for further community coming together. And I hope that's the case, but it feels currently, I don't want to say dispowering, but that's how I feel personally. I feel usually anger inside will need to go up and do some more things, but I feel less empowered, less angry, and more frozen and inactive. Anyway.
What are some of the stress as someone who's been doing meditation and martial arts and all these types of things for many years? What do you do when you feel frozen?
Well, that's a sort of I must say that I'm in a place where I haven't found relief from my practices, and I just trust, the divine, that it is there for a reason, and that my backup my history with the practices and my overall background is sufficient to eventually find the right reconstruction for myself and right engagement. But right now, I must literally say that I don't know. I don't have answers, and I've been practicing, spiritual work for over 20 years, and so I think it also highlights the fact that these practices are not an answer to everything. They're there to help us, and they're important, but they're not substituting to other resources that hopefully we're all going to find internal and external. And I'm not a good example of that, and I will admit that, and that's okay.
It's definitely indicative that, healthcare is a social justice issue, something that I know a lot of us, are familiar with. We had one question from Venetia about how hydrochloroquine, it's being downplayed when it appears to be effective in many cases. For example, I'll just read directly her question. In addition to the French reports and those from US doctors treating folks with lupus, etc., who have been treated effectively with hydrochloroquine or have been taking the drug they have not contracted COVID, plus there's anecdotal recoveries about recovery with hydroxychloroquine. I'm not understanding why this drug is constantly being downplayed when it appears to be effective in many cases.
So I don't know, Venetia, if you listened to earlier what I said, but the New England Journal of Medicine, that was a large double-blind randomized trial that showed no efficacy, no side effects, but no efficacy. So I don't know. It almost feels like that my opinion also changes nonstop because I'm trying to follow the data that's changing every day. But nonetheless, I don't know. I don't think that the hydroxychloroquine is as effective as we first felt. I also feel like we need more time to sort of have more studies to prove or disprove. And if there is a niche for hydroxychloroquine, then what is it? As I mentioned last time, a number of European countries have actually discontinued use of hydroxychloroquine for COVID completely and put the statements that it's no longer allowed. We don't know whether FDA will move to something similar. We'll have to wait to see. But if that happens, that will be a formal government statement. But, Venetia, your question is more as to, what data is correct. I don't know. I think we'll have to see.
Well, I think that we have to wrap up for today. Janet, is that?
Misha, we had 2 mass questions that would be nice if you answered. One is, how about cloth masks? Are they helpful?
Yeah, so I think the comparison between clothes and surgical, I think surgical wins because the paper flaps that are put in multiple layers tend to work better. But it's definitely better than nothing, and closed masks are a lot more comfortable. So the way I kind of think of it, if risk is very small, like let's say you're walking outside, but it's pretty crowded, not very crowded, but you're going to walk into people on a regular basis, I think the closed mask is more than sufficient because it's very short exposure for just a brief seconds. But the other point in when you get your hair cut, well, you're in the one spot, you stuck with several people close to you. That's when I would actually think if you have a surgical mask, that would be better. If you have a 95, of course, that's perfect. I'm just saying it's probably not 100% necessary, but that's when I would use something more significant for protection. So, and I would probably do this if you have a surgical mask and you're going into the public for protests, or I would probably also use surgical because I would expect that you're going to be closer there with people, and you're also going to have very little control of potentially of sort of who's going to be next to you. If you're outside walking, exercising, and there may be people coming close to you, you can probably walk away. So I think in that case, closed mask is much more comfortable, is not interfering with breath as much, and it's much easier to wear. Okay. They also have those inserts. Many closed masks now have those charcoal inserts. I've also heard some good things about them because they are also providing extra layer of filtration. So I'd probably use that if you have it.
I myself use coffee filters.
Yep, a coffee filter. I mean, I think any material that pushes air to go through is gonna drop further any chances of droplet particles sifting through. Remember, you shouldn't worry about the sizes of pores in the material. That's totally irrelevant because virus is not flying around. It's flying around in the droplets. So the droplets themselves have to have a minimum size, and that minimum size is going to get caught by everything, by any mask. So that's not the issue. The issue is when you have tons of droplets all over, which mask is going to filter it out better, and that has to be done in a controlled environment to answer the question. And those are the things I'm trying to answer.
Thank you for that, Misha, because that answered the follow-up question neatly.
Okay.
Yeah, absolutely. I think we're wrapping up for today. All of these, Janet, is that a thumbs up on wrapping up? Okay. All of these links and resources are going to be sent out in the follow-up email, where you can also sign up for next week. There's also an exciting article Janet found saying how a regular mindfulness practice actually is a way of limiting your bias. And is a way to change your own way of thinking. And I will hopefully I'll have my mask and I love the coffee filter. I'll be on personally be on 16th Street tonight for a vigil, and tomorrow at the Martin Luther King Memorial. If people are interested in doing a more deep dive into mind-body practices, we do have a 6-week class coming up on stress and coping, and that'll be about 15 people, hosted by Dr. Kogan, myself, and Dr. Kassoff, meeting on Wednesday nights on Zoom from 5 to 7. Let me know if you're interested in that. We'd really love to have you. Any final words, Janet?
Just everyone be well and be safe.
All right. Thank you, everyone.
Thank you.